Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case study on mesial canal, mesial MB2 canal. Okay, so of the mesiobuccal root. Okay, so basically patient first came with the chief complaint of upper left side. Okay, so this is the upper left side, the area of chief complaint. Now this is a panoramic scout image, so it's basically a low resolution image. So this type of image is usually taken before starting the CBCT scan. So just to check the confirmatory area, so we took this image and we saw some kind of pathologic lesion over here, and hence then we took a CBCT scan. So coming to the CBCT scan of the same area of concern, so this is the 3D volume image, this is the axial image, this is the coronal image, and this is the sagittal image. So we will just go and study root by root. So this is the mesiobuccal root canal. Okay, so this is a mesiobuccal root, the distobuccal root, and the palatal root. This is of 2-6 and this is 2-7 region. Okay, so this is the mesiobuccal root, this is the distobuccal root, and this is the palatal root. Okay, you can check the root canal status as well. There's the buccal aspect and there's the palatal aspect. So coming to the root canal system, this is the mesiobuccal 1, that is MB1 root canal system. So you can just arrange it along the long axis of the tooth. Okay, the lines are arranged along the long axis of the tooth. Okay, so here the root is curved and hence it is not very well appreciated. So now you can see it in the coronal section. You can just increase or decrease the thickness also. Increasing the thickness to 2 mm will automatically correct the image noise, and decreasing the thickness to 0.5 mm will give you a good clarity of image, but you can see the image becomes a little grainy. So hence it is always ideal to see it in 1 mm thickness. Okay, so this is mesiobuccal 1 root, and this is the distobuccal root, and this is the palatal root canal, distobuccal root canal, and the mesiobuccal 1 root canal. But we can see some kind of pathologic lesion over here. So we'll just study the axial cross sections slice by slice. So this is basically the coronal restoration that is seen. Now there is suspected beam hardened artifacts noted with increased image noise due to the metallic restoration, and hence that's why we always tell the patient to remove the metallic jewelry before the scan. But the fixed restoration cannot be removed, hence it is always advisable to take CBCT without coronal restorations, or a temporary restoration is fine. Now see the sagittal section. This is the sagittal section of root 2-6. You can just reverse the image. Okay, this is the 2-6 mesiobuccal root. Okay, so you can see well defined pathosis. Now why this pathosis is there, so we'll just study it in the cross section images. We'll go slice by slice. Okay, so we'll just observe in the axial cross sections. Okay, so we'll just take this line over here, slowly go from coronal aspect to uh, the apical end. So we'll just arrange this along the mesial aspect of the root. Okay, so going up. Okay, just observe it slowly. Okay, so you can see this thing over here. If you want, you can hide the lines as well. So that now the lines are hidden. Once again, just see it from the occlusal aspect and go towards the apical root region. You can see some kind of radio opacity over here, radiolucency over here. This could be the evidence of MB2 canal. Okay, this radio opacity which is there. Okay, so if you want, you can just double click the image and just see the image over here. You can see this line which is a dot which is there. This could be the chance of being a MB2 canal. Now if you want, if it's not very well appreciated in 1 mm thickness, so you can also use 0.5 mm thickness. So now just see the same thing in 0.5 mm thickness. There's 0.5 mm thickness. You can see the dot over here. Just double click it and see the dot is also evident. Yes, it is evident. Okay, so this is the dot which is seen. We'll just go back and once again go a little bit apically. You can see the dot. It is very well defined, and but it gets lost. It becomes faint as we go apically. Why it happens? Either the canal is filled with debris or some kind of infection, or there might be some kind of blockage in the MB2 canal. But surely MB2 canal is there. If you want, you can just mark this thing. You can see the dot. You can just mark this thing over here, and that's your MB2 canal. Okay, now it is very well seen. But the same thing, if you just increase the thickness to 2 mm, it is not very well appreciated. You can see it has become the dot has become faint. See this, it's not very well appreciated as compared to what you see it in 1 mm or 0.5 mm thickness. Okay, hence it is better to view it in a lesser thickness one, but the image might become grainy. Hence the best way is to remove the metallic restorations before starting the scan. Now we'll just arrange the tooth along, arrange these lines along the long axis of MB2 root canal. Okay, so this is your MB2 root, and there's your MB2 root canal where the lines are present. Okay, we'll just arrange this over here and see it in the sagittal section. So it may not be seen in all the cross sections, but it will definitely be seen either in any of the two cross sections. So here we can very well appreciate in the mesiobuccal 2 in the axial cross section and in the sagittal cross section. So you can see a faint radiolucent line appearing over here. That's your MB2 canal. Okay, then it gets lost in the lower middle one third region of the tooth. Now we'll just see this thing. So it is very well seen, and then it gets lost and seen with apically. So that's your MB2 canal. Okay, so you can see it over here. You can very well appreciate the apical region. Okay, so the main reason for this pathosis is because of presence of an extra canal, which is commonly seen in maxillary first molar region. Okay, so this is one of the reason of endodontic failure. So what treatment can be done? So usually you just have to do the MB2 canal filling by either using dental loops with 2x or 4x magnification, or using dental operating microscope, or by taking an expert advice, an endodontist specialized in root canal treatment. Okay, so there's your MB2 canal as seen in the sagittal section at the middle one third region, and at the lower middle one third apical end region, and seen in the axial image. But the same MB2 canal is not very well appreciated in the coronal section. Why it happens in this way? Because the usually mesial roots are usually curved, and hence it is not very well appreciated in all the sections, but will always be seen in either of the two sections. So if you want, you can just divide this thing into some cross sections by doing the arch marking. So we have done the arch marking. You have the coronal cross sections, but as mentioned, it is not very well seen. This type of section is usually recommended if you want to go for virtual implant planning or something. But as you can see, this thing, our line is on the mesial root. The MB2 canal is not very well appreciated here, but the pathologic lesion can be seen as the palatal canal. You can see it is short of apex, and hence periapical lesion is seen. There's the mesiobuccal 1 root canal, there's the palatal root canal, and there's the distobuccal root canal. Okay, so if the doctor wants to extract the tooth, not recommended since the treatment can be done. You still have good bone width and height for implants, as you can see, or a sinus lift procedure if needed. But we won't be doing this. We'll be studying an endodontic case, so and hence I'll be deleting this line. And instead of taking the spline marking this way, I'll just do the spline marking this way. So there's exactly like going from the palatal root to the buccal aspect. Okay, buccal aspect to the palatal aspect when you see the green line. Okay, so now coming to the buccal aspect, this is the buccal aspect. You can see this is the mesiobuccal 1 root canal. I'll just decrease the thickness to, instead of 10, I'll just keep it 5. Okay, so there's the mesiobuccal root. And you can see in this cross section, there's the mesiobuccal root and there's the distobuccal root. Now we'll just take one more section here. There's the mesiobuccal root canal infection, and there's the distobuccal root. You can see this line. There's the mesiobuccal root and distobuccal. Now you can see this. This is the mesiaobuccal 2 MB2 root canal system. Okay, you can very well appreciate here, and this is the pathologic lesion as seen in the slice. So somewhere between 4 mm, 4 by 4. Okay, and then as you go inwards towards the palatal aspect, this is the palatal root, and you can also see palatal canal. You can see it is short of apex, the apical end needs clinical evaluation, and pathologic lesion is also evident here. Okay, so all the cross sections are seen. So what now we'll study is the axial cross sections. How we'll study the axial cross sections? You can just drag this image over here. Now there's the coronal. I'll just go from occlusal aspect to the apical end region. Okay, now if you want, you can study the same thing in 0.5 mm interval lines. Also note these lines become very close to each other. You can appreciate all the cross sections together. You can see the mesiobuccal 2 root canal very clearly. But the thing is, like, the lines become very close to each other. And the same thing you can study here either in 1 mm thickness, 1 mm interval lines, or you can study in 0.5 mm interval lines based on doctor's need. Okay, so we'll just study this in 0.5 mm interval lines. Okay, so this is the occlusal aspect going towards the root region. There's the crestal alveolar ridge. Now going more apically, you can see the orifice region. Now this is the mesiobuccal, there's the distobuccal, and there's the palatal. Going down, there's mesiobuccal 1, small evidence of mesiobuccal 2. Okay, MB2 root canal, MB2 root canal. Okay, MB2 root canal. You can just mention it. So now you can see how the MB2 root canal disappears in this cross section. So the reason behind this, either the canal is, there might be some kind of debris, and hence it needs biomechanical preparation. Some kind of irrigation is needed for the canal visibility. Okay, there's the this is the palatal root canal, this is the distobuccal root canal, and this is MB1. Wherever MB2 is seen, you can just write it down over here. This is MB2 root canal. We'll just write it down, MB2 root canal. Okay, if you want, you can just mention it faint appearance. Okay, so as we go down apically, now you can see some kind of pathologic lesion has developed over here. Okay, in the mesial root. Why? Because the MB2 root canal is not filled, and hence one of the reason for endodontic failure. Okay, so hence MB2 root canal needs filling. This could be the apical end of MB2 root canal, as you can see a dot over here. Sorry, this is a distal root canal, but the sorry, this is the mesiobuccal root canal. So and hence I was right. Like this is the MB2 root canal apical end, and this is the distal root canal, and some kind of pathologic region is seen. Now you can also see the palatal root canal as it is short of apex, and hence it is clearly seen. Why all this is seen? Because we are studying this in 0.5 mm cross interval lines. Also note, this is the sinus and this is the pathologic region. This is the sinus and this is the pathologic region. So you can do the namings accordingly so that the clinician is not confused. Okay, so this was all about findings of MB2 root canal. Okay, so also note that you have to study all these things either in 1 mm cross section, okay, either in 1 mm or 0.5 mm, which is ideally recommended. As you can see this thing very well in 0.5 mm, and not in 2 mm. As you can see in 2 mm the image may appear like the graininess may be removed, but it is difficult to appreciate MB2 root canals. It is usually recommended if you want to go for bone virtual implant planning or bone dimension marking. So that time you can do 2 mm, but for cases like endodontic cases, either 1 mm or 0.5 mm is very well recommended. Okay, so getting back to 0.5 mm, you can always view the same by decreasing or increasing the contrast, darkening the image or brightening the image. Also by playing with the histogram, you can just use the help of histogram. You can see this. Now you can also apply or decrease the sharpness filter. Okay, so it's always better to keep it the best filter possible studying the endodontic scans, and always have sharpened image, crisp images, as you can see it in this. Okay, so this was all about MB2 canal evidence. Okay, yeah. Okay, thank you so much.